Assalamu alaikum. Let's dive into the fetal part, fetus, of the obstetric part of a USMLE inner circle. Start with this gestational age. Before jumping into this, let's hear this. Can you guess the murmur? Okay, if you put it in the comment box. Now, what is the most accurate way to determine estimated gestational age? Ultrasound, crown, rump measurement. Ultrasound crown rump measurement is in the first trimester. Last menstrual period may be used to determine um, gestational age if the patient has normal means and reliable LMP. But the most accurate way is ultrasound round rump measurement in the first trimester. After 20 weeks of gestation, After 20 weeks of gestation, fundal height in the centimeters should be directly correlate to the gestational age. After 20 weeks, so fundal, so according to fundal height, it is 24 centimeters, so it 24 weeks. According to fundal height, it is 28 centimeter, so it's 26 weeks, and up to 32, it corresponds correlate with the gestational eggs in a week with a small variation, uh, 2 to 3 centimeter. Now, fetal surveillance. This is a very important box. In here, there are some clue we need to remember. In non-stress test, external fetal heart rate monitoring for 20 to 40 minutes. It is reactive, means more than 2 acceleration, and there is 2 points. Reactive is more than 2 acceleration and 2 points, and abnormal result is non-reactive, less than 2 acceleration, a recurrent variable or late deceleration, 0 points. What are the factors we see in the biophysical profile? Amniotic fluid volume, fetal breathing movement, fetal tone, amniotic fluid volume, fetal breathing movement, fetal tone. This non-stress test plus ultrasound measurement of the following. So non-stress it got 2 point, and these four got 8 point. Total is 8 or 10 point. Equivocal is a 6 point, abnormal is 0, 2, and 4 point. And their abnormal result may be oligohydramnios. So non-stress test it got 2 point, and the tone, breathing, fetal tone, breathing, movement, and amniotic fluid volume. Now, contraction stress test. External fetal heart rate monitoring during spontaneous or induced uterine contraction. During spontaneous or induced uterine contraction, no late or recurrent variable deceleration. Late deceleration with more than 50% of the contraction. Late deceleration with more than 50% of the contraction. Now, Doppler sonography of the umbilical artery. Evaluation of the umbilical artery flow in fetal intrauterine growth restriction only. High velocity of the diastolic flow in the umbilical artery. Decrease, absent, or reversed in diastolic flow. In biophysical profile, these 5 factors is seen to each point. Non-stress test, reactive fetal heart rate, amniotic fluid volume, single pocket more than 2 into 1 centimeter, amniotic fluid index more than 5, fetal movement 3 or more than 3, general body movement, fetal tone 1 or more than 1 episode of flexion, extension, limbs or spine, fetal breathing movement 1 or more than 1 breathing episode or more than 30 seconds. 0 to 4 it is fetal hypoxia, urgent delivery. 6 repeat in 24 hours. 8 to 10 is normal, rules out the fetal hypoxia. What is the recommended management? What is the recommended management for a pregnant? What is the recommended management for a pregnant woman at 32 weeks of gestation? Pregnant woman with a 32 weeks of gestation with gestational hypertension and biophysical profile score of 6 at today's visit. Repeat the biophysical profile in 24 hours. Repeat the biophysical profile in 24 hours. Pregnant woman with gestational hypertension need weekly biophysical profile starting at 32 weeks gestation. A biophysical profile 6 out of 10 is equivocal and should be reported in 24 hours. What is the next step in the management for a pregnant woman at 34 weeks of gestation that presents with decreased fetal movement? Non-stress testing reveals normal fetal heart rate and is non-reactive despite of vibroacoustic stimulation. Biophysical profile or contraction stress test. Biophysical profile or contraction stress test choice of test depends on the source available and contraindication. Contraction stress test is contraindicated if there are contraindication to labor such as placenta preview or prior mammectomy. Normal fetal movement more than 10 movements in 2 hours. More than 10 movements in 2 hours. What is the next step in the management for a patient? What is the next step in the management for a patient? What is okay now? What is the next step in the management for a pregnant woman and 32 weeks of gestation that presents with decreased fetal movement? Heart tones are heard by Doppler. Non-stress test should be done. Non-stress test should be done. Recording of the fetal heart rate while monitoring for spontaneous perceived fetal movement. What is the most common cause of non-reactive non-stress test? It is fetal sleep cycle. Non-reactive non-stress test fetal sleep cycle. Vibroacoustic stimulation may be used to awaken the fetus, and sleep cycle can last as long as 40 minutes. Therefore, a non-reactive test should be extended to 40 to 120 minutes. If you extend the non-reactive test of 40 to 120 minutes, you can find out is it fetal sleep cycle or is it there is some problem. So what is normal? That means reactive, non-reactive, normal, non-stress test. It is baseline fetal heart 110 to 160, moderate variable is 6 to 25, and more than 2 acceleration in 20 minutes. More than 2 acceleration in 20 minutes and peaking more than 15 minutes above baseline, and fasting more than 15 seconds. Fasting more than 15 seconds. Non-reactive does not meet the criteria for reactivity. Non-reactive does not meet the criteria for reactivity. It is due to fetal sympathetic nervous system activity which develops around 26 to 28 weeks. No reactivity before 28 weeks. Non-stress test, non-reactive vibroacoustic test, biophysical profile, still non-reactive or equivocal low score contraction stress test. So first, non-stress test is it if it is non-reactive, then do vibroacoustic test. Still non-reactive, do contraction stress test. And can a reactive non Stress test effectively rule out the fetal acidemia. Yes, a reactive non-stress test, a high negative predictive value for fetal, a high negative predictive value for fetal acidemia. Non-reactive non-stress test has a low positive predictive value for fetal acidemia, high rate of false positive. So reactive non-stress test has a high negative value for fetal acidemia, but non-reactive non-stress test does not have a low positive predictive value. Late and postpartum pregnancy require antenatal fetal surveillance begins at 41 weeks. A biophysical profile to screen for fetal hypoxia. Late and post-term pregnancies are at risk for uteroplacental insufficiency, oligohydramnios, late deceleration. Aging placentas may have decreased fetal perfusion, which causes a decreased perfusion and urinary output. Late term and post-term pregnancy complication: fetal oligohydramnios, meconium aspiration, stillbirth, macrosomia, and convulsion. Oligohydramnia, meconium aspiration, stillbirth, macrosomia, and convulsion, and maternal is cesarean delivery, infection, postpartum hemorrhage, and perinatal trauma. Okay, now this box. This is a very high yield and wonderful box. Uh, Look at the onset. Onset. Uh, one, one small square is 10. One small square belongs to 10 second. Okay. Okay, that's all about fetal surveillance. The next part of the fetal heart rate will be discussed on next video. Hope you got connected.